I never realized I really had that big impact on people's lives until my husband died a year and a half ago. The impact I had in the community until I saw that, it was like an avalanche of wishes and cards. I didn't know.
There's a lot of families that can't make the trips into Fairbanks, and then having her be here consistently every month gives the parents an opportunity to take their kids in, get the medical care that they need, the vaccinations that they need. If their kids are sick, they have somebody reliable that they can bring them to who remembers all of their children's names, remembers their names. She knows who everybody is.
I've been the nurse for the community Nana down to Cantwell for 20 years straight. So I've got a whole generation down. Folks that I thought were hopeless, it's amazing over the years to see kind of their strengths blossom and them do wonderful when you wouldn't think, or vice versa.
The interior is the largest region geographically of Alaska. It covers a huge area, and the thing that's unique about it is that it also has one of our largest communities, Fairbanks, a community of about 35,000. We have the largest public health center that is owned by the state of Alaska. It's a beautiful facility. We have a little over 30 individuals working out of this health center.
15.5 teaspoons of sugar in that juice. I never get bored at work. There's always something new that you can be learning, always something new that you can be teaching to others. I love the variety of work that we do and the relationships that I'm able to build with just a wide variety of community members, from infants and children to teen moms to our elderly population.
One of the strategies we have that we are working on with the community is to try to decrease obesity here in the interior.
Good job on your underwater kicks.
Childhood obesity is an epidemic in the state of Alaska and the whole United States. I think this is a really important class because we're working with another partner in the community to help reduce the risk of childhood obesity in our city.
Okay, I'm going to have you go ahead and hold her, and I'm going to listen to her learns while you're sitting up. In the Fairbanks Public Health Center, we have 9 exam rooms. In addition to the 9 exam rooms, we have 2 rooms that we've made what we call well child rooms, so they're children friendly. We can of course care for adults in those rooms, but we try to create them more for the families that come for children's exams.
I think it's the greatest adventure. It's certainly the best job I've ever had, and I've worked in hospitals and nursing homes and hospice, home care, everything, and you bring all your skills to public health and you get to use them.
The work is really fascinating. It's very interesting. It's unusual. We have the opportunity to work with populations, with the community, and to integrate your one-on-one kind of clinic care and integrating it into the population, more of a population-based outreach.
For the immunization audit.
What I like is the opportunity I have for ongoing relationships with these families and watching the kids grow up and helping them stay healthy.
Alaska, for me, has been sort of the closest thing to serving as a nurse overseas as possible and still live within the states. There's some very unique things to the state of Alaska. Even looking at tuberculosis, it's something that we really didn't learn much about in nursing school.
And for this guys, you had a flu shot before? Public health is not the kind of nursing where you see someone getting better tomorrow or a real quick fix to things that go wrong. It's a long-term process, and so you need to be able to keep your focus on the long term and to see the small steps of progress along the way to getting to your ultimate goal.
Some of the most satisfying aspects of the job are helping to prevent problems before they happen. I work on a team of nurses that does a lot of work prenatally with women and then with families with very young children. And so building those relationships with new moms and dads and their babies is really fulfilling fulfilling, and knowing that some of the information that we're able to teach and help in developing a healthy bond with an infant, starting out with healthy eating habits just at a very young age, can go on and make a difference for the rest of that child and that family's life together. That's one of the really rich things about public health that's very satisfying for me in my work.
This was the original recruiting poster for the state of Alaska for nurses. So this is the poster that brought me to Alaska 20 years ago to come up and work in public health. The adventure was true. It's a great adventure.
You get to see people's, sharing their joys of the new babies and the tragedies of the deaths. And when I got that outpouring of support and love from everybody in these communities, it kind of motivated me to, get over my whining and get back to work. And it kind of helped me refine that purpose. I'm doing what I'm supposed to be doing.